Hello, I am Antti Turunen from Helsinki University Hospital, and I will present our study concerning circulating Syndecan-1 and heparan sulfate in acute pancreatitis, or AP for short. Syndecan-1 and heparan sulfate are constituents of the glycocalyx, which is a gel-like layer covering the luminal surface of vascular endothelium and consisting of proteoglycans and glycoproteins, for example. The glycocalyx is essential in maintaining vascular homeostasis. However, during systemic inflammation, activated circulating leukocytes release products that cause degradation of the glycocalyx and release of its components to the circulation in a soluble form. Glycocalyx degradation leads to compromised vascular function and propagation of organ dysfunction. Several studies have shown that Syndecan-1 and heparan sulfate levels in plasma are associated with the severity of sepsis, but less is known about them in AP. As prediction of the severity of AP remains a major clinical challenge, we wanted to study if Syndecan-1 and heparan sulfate might be useful as predictive biomarkers for development of organ dysfunction in AP. The study includes a sample of 210 patients treated at Helsinki University Hospital during a 6-year period. The patients were included within 72 hours of the onset of symptoms, and Syndecan-1 and heparan sulfate were measured from frozen plasma samples by a commercial ELISA kit. 8% of patients had severe AP, which is characterized by persistent organ dysfunction. In these box plots, we see that the Syndecan-1 levels in plasma of the patients with severe and moderately severe AP were higher than in those with mild AP. However, the heparan sulfate levels were not associated with the severity of AP. In ROC curve analysis, Syndecan-1 level predicts severe AP in a statistically significant way. However, the sensitivity and specificity remain inadequately low for any clinical usefulness. So, in conclusion, plasma Syndecan-1 shows only limited predictive potential in acute pancreatitis. However, we are working on further analysis, potentially linking Syndecan-1 and heparan sulfate to the outcome of intravenous fluid treatment. Finally, I want to acknowledge my collaborators in the clinic and in the laboratory, and thank you for your attention to this e-poster.